You're tuned in to RX Radio.
All right, guys, welcome back. Another episode of RX Radio. Today, White, first and foremost, with me, as per usually always, Dr. Jordan Jiunta in the flesh.
Great to be here.
I should just do your intros for your office every day. I should be your secretary. Imagine that. Just roll like pyrotechnics, just blow the whole thing up.
My
Shoulder pain
way too
on
big.
the docket.
Yeah.
You need it. You need to get your tires pumped every now and then.
That's true.
Okay, on the docket today, shoulder pain. Taking a look at shoulder pain from a very broad lens right down to the nitty gritty of exercise selection, execution, all things managing shoulder pain. And I think the good thing about the shoulder, because it has so much variability in movement, such a high prevalence of injury and just weird nagging shit, that you can infer a lot about pain management in general from an exercise selection, execution, programming standpoint, that you can actually start to cross-pollinate some of these concepts to pain in other areas of the body. That being said, if you want to learn more about upper body exercise programming, application, all of that stuff, we are in Edmonton, Alberta in a handful of weeks, December 16th, 17th, 18th, 17th, 18th at the Vault in Edmonton. 4 weeks later, we're going to be in California doing another upper body intensive at Mind Pump in Santa Clara, California. So be sure to check that out. All details are up on the website, www.pre-script.com. PSL 1 is also up for sale. That course goes live January 11th. Classes start, if I'm not mistaken. So registration is also online. I believe that's up on the homepage. Weekly newsletter. If you guys want to sound smart to other coaches at work, or actually just learn some really valuable shit across all aspects of coaching, psychological to physiological, go to prescript.com newsletter. Just scroll down halfway through the homepage. It is there. Toss your email in every Friday. That's getting dished out with some awesome contributions for some awesome coaches. If you're a coach that wants to contribute, do reach out to us. info@pre-script.com. Did I miss anything?
Not that I can think of. Crushed it.
Holy man. Tell you what, after 247 episodes, I think we might be on to something here. Guys, shoulder pain, tell your friends, and we'll see you next week. Enjoy. This is my coming to life. This is, you know what? That should be my alarm clock every morning. Just like a giant 3, 2, 1 countdown.
Lundy just knows if he doesn't start it, we'll just bullshit forever.
Dude, how many times was that the case, though? Back in the Disney, we would just sit there there would be so many times where we go to his office to do a podcast, and it would have been amazing. We would have got canceled before canceling was a thing.
Yeah.
But we'd just sit there and just be like, well, what about this? What about this? What about this? And just tangent for an hour and a half. Because you've had some segue. Because have you ever had a traumatic shoulder injury?
I've had a suspected torn labrum. Still have a suspected torn labrum. I never got checked out.
Is it your right shoulder?
Yes, it is.
Yeah, I know.
You've been seeing my snatch videos, huh?
Well, no, it's just I remember watching you prep at the AO. So when we went out to Vegas and you did this shaky arm before you started lifting, especially on the snatch, and I was like, something's going on there, because I've torn. Oh, fuck, dude. I don't know if there's anything in my shoulder that is still the way it should be. Right pec, missing a big chunk of that. Left labrum is now the hood ornament for a 1991 Chevy Suburban. That was fun. Yep. So that with that slap tear, so bicep tendon went with that. Suspected supraspinatus tear on the left, separated left AC joint. Yeah, so that's pretty much the gambit for me on the structural side of things. And then your everyday sort of ache and pain kind of thing is any pinches in the front, it pinches in the back, it pinches in the overhead, it hurts when I do dips. I think it's linked to my elbow. Shoulder pain is probably the thing that in our practice, when we got into chiropractic college, everyone's like, neck and low back pain. Be really good at neck and low back pain. That's what people go see chiropractors for. Where it's in our niche, especially you with Olympic weightlifting and CrossFit, I feel like shoulder pain is probably one of the highest nagging injury things that most people deal with.
Yeah, absolutely. And a lot of the people that I see for shoulder pain are people that have no business loading overhead position, and they really like loading the overhead position. So it's it's always a concept of Are you able to create stable shoulder positions? If not, no. Then what are you actually loading? You're not loading the musculature. You're loading the structure of the shoulder. And that's a lot of times when I see, in the gym at least, shoulder injuries, it's usually some sort of imbalance between what they're actually loading. Because that's the way I think of things, is that if you're loading a position, that's, it's the path of least resistance, right? If you're not able to functionally create a way to buffer that force, then you're going to structurally create a way to buffer that force. And that's labrums, that's tendons, that's ligaments, that's joints, as opposed to loading musculature. And when you do that repetitively, those things break down. When you load,
I think even more so in your space, just because it's like so much or all exclusively is barbell training, right? Like such an unforgiving medium. Free weights, barbells, kettlebells, dumbbells are such unforgiving mediums where it's like a little bit of a different game in like the bodybuilding space, because what you lack in instability by medium, which is to say, like, if I put a bar over my head, this bar can move in any direction at any given point in time. Now, dumbbell's going to be a little less stable from that because it's not going to be linked to the stability or base support of my other hand. Kettlebell more unstable than that, because obviously like the distribution of the load and like the offset point of the center of mass of the kettlebell. But with bodybuilding, it's like they can offset that instability by going, oh, okay, my shoulder itself's not stable from like a muscular perspective, but the machine I'm sitting on like augments that and allows me to use some of this external stability so I can keep pushing through. What is like, and this is somewhat, and I've always kind of hypothesized this, that's to a greater detriment to a bodybuilder, because I feel like their ability to establish a very hardwired, like neurological path of least resistance of like, hey, this is how we recruit in the overhead position, that's devoid of serratus anterior, that's devoid of supraspinatus, that's devoid of, glenohumeral depression, or like the arm really staying centered in the shoulder joint, and the humerus staying centered in the scapula. So I've always gone back and forth and being like, does the overhead, is it more difficult to manage pain in the shoulder with like a barbell overhead athlete or like a bodybuilding quote unquote overhead athlete? And I think I finally rested on it. It's harder with the bodybuilding crowd, because the tissue they are attempting to train, the muscle that they're attempting to train, casts them in a position where the pure active range of motion overhead position is further and further away from them because of the amount of musculature they've been able to hack onto their skeleton by using this external support. So their body is so used to pressing up and down compared to like an ollie lifter or compared to a CrossFitter. It's like bodybuilders will do triple, quadruple drop, super set, rest, pause with BFR bands on their shoulders. And it's like, man, they did an entire weightlifting prep worth of repetitions in a single set. Yeah. So that's an entire prep worth of learning a certain pattern that emphasizes isolation of, like, let's say the anterior delt, that minimizes the necessity of like some sort of Hoffman's reflex stabilization loop through the bicep, that minimizes any scapular upward rotation that a barbell would necessitate to complete that lift, right? Any serratus anterior involvement, any lower trap involvement. So I think this speaks more to like the general population fitness person, like, hey, you have a client in the gym, or hey, you have a client, or you are just a general fitness enthusiast in the gym. Pushing out to like create like a buffer of function is always to me a very useful endeavor, regardless of whether or not it has a direct impact on the objective outcome that you're trying to reach. What does that mean? Well, that's like, if your goal might not necessarily be to get a big snatch, or that's never not a weird thing to say, right? Just if we take a minute to recognize that we have weird verbiage in our world, but like to get a big snatch or to get a big overhead press or something like that. But an overhead press could be something that you proxy to shoulder function and the musculature that supports the shoulder, and that allows you to get a big bench press or get big pecs or get big lats. It's like, the shoulder just takes an absolute fucking beating, and it's a goddamn miracle of modern science that the whole thing's held together at all. And I think a lot of people go, well, my goal is this. It's not big overhead press or heavy snatch. it's just to get a bunch of muscle. It's like, look, the barbell overhead press or dumbbell overhead press might not be the most economical tool to stimulate a hypertrophy response in particular muscle groups. Not even the deltoid, which is like primarily the main mover in most overhead pressing movements. But it's going to be the thing that indirectly, if you keep it in your program, it can be something that signals early stage dysfunction that's leading to pain. Maybe it's in the elbow, maybe it's in the wrist, maybe it is directly in the shoulder, maybe it's in the low back because you're compensating. So it's like, I always challenge people to find these exercises that ask the most of the particular joint in which they cross, like a gatekeeper exercise. Like, if you can't do this exercise, you shall not pass and then do other movements through the shoulder, or at least in that particular plane. Because the overhead pressing falls, it almost like it falls in and out of vogue. Like, I remember strength coaches in like Major League Baseball were like, no overhead pressing ever, because like they're dealing with overhead athletes. It's like, I kind of get it from like a fatigue management standpoint, but I'm going to want that signal that there's something wrong with the shoulder in the controlled environment of the weight room, rather than like, you know, 8th inning, 2 on, 2 out, and now he throws 100 and tears his rotator cuff, right? So it's a good canary down the coal mine. So one of the things that I think, if you're listening and you're like, okay, well, what is my first step in assessing for shoulder pain? It's like, how easily can someone get into actively the overhead position uncompromised? That I think is like a really good proxy to start, because some people might get into the overhead position fine and still have pain. It's like, okay, we're probably going to have to chase down a potentially different underlying cause. But for most people, as they start to ascend into that overhead position, it's like, it hurts there. It's like, okay, maybe that's where we begin to draw the line in early stages. Scale it back a few degrees. Like, this is your safe loading zone. Anywhere that doesn't hurt inside this arc of flexion or abduction, this is where we start to begin the active rehabilitation process. And what that honestly usually looks like is scaling the amount of load. That's really what the good biomechanical decisions do, is we're just going to load this shoulder less, right? So whether it be less intensity, less density, less overall volume per week, it's like there needs to be a stage of relearning that's not going to be attainable by driving high density, high intensity, high volume.
Yeah, I like that you use the word learning there, excuse me, because a lot of times what I see with people that can't get into an overhead position is, first off, they don't know how to use their core. They don't know how to properly brace their trunk to create stable positions for the rib cage, for the scapula to move around, right? They don't understand scapular control, how to create upward rotation, or even, you know, to simplify front to back, like protraction, retraction, elevation, depression. And then the last kind of link in the chain is actually going to be what's happening at the shoulder, right? It's for you to properly get into a stacked, structurally stable overhead position. It's going to start essentially from the ground up, but basically it's going to radiate around what's happening at the pelvis, what you're doing to control the pelvis through the core, and then how that dictates rib cage position. And then from there, you can start to learn how to use the scapula, stabilize the scapula against the rib cage to be able to create stable positions overhead. So I think
one of the big, go ahead, sorry.
I was just going to say, I think a lot of people that don't do that properly, it's because they don't understand that each of these is an important link in the chain that's going to create structurally stable positions that allow them to express that overhead position.
One of the biggest problems I see in early stage rehabilitation, and even in exercise programming that leads to the need for rehabilitation, is trying to gain access to the overhead position by attempting to access the overhead position. Like, if like one of the biggest myths that I've seen in like rehabilitation and fitness, like, have you ever seen Family Guy?
Yeah, I've seen
where
Family Guy.
But yes, so but in Family Guy there's the manfish, where like they talk about the mermaid from the perspective of the fish being the head and the human being the legs, which is not what anyone wants, right? Like, you want the chick upper body and you want the fish tail. Like, that's kind of, if that's your jam, that's definitely how you want that collaboration to go. Like, the fish head with the human legs does nothing for nobody. Like, that's not a fetish anywhere on the internet. But it's like, that's what training and rehabilitation has become, is just like this man fish of the worst of both of these situations. And it's like, no more is that present than, oh, having difficulty with the overhead position, put your hand over your head and lay on the floor and do a bunch of Y raises. It's like, okay, I understand the lower traps role in creating a dynamically stable scapula. But to think that like a Superman and just jamming and just doing one of these things is going to fix your problem, if that fixes your problem, then you didn't have a real problem. That's how I look at it, right? Because it's, to me, understanding the importance of reaching low in order to access positions high, right? The Roman chair, for me, like that little ab thing that people do, is one of the early things I'll do in giving access to the overhead position to a completely detrained individual. Because a lot of times we think of core or an exercise like that, like, you know, posteriorly tilting the pelvis, maybe there's some transverse abdominis, some rectus, some obliques, good core exercise. A lot of times when people are doing that exercise, their fucking AC joints are jamming up their ear holes. But it's like one of the best things that exercise offers you is a net upward force on the scapula, to which you have to be able to resist force as you start to move peripherally, right? As your legs start to swing about underneath you, you actually need to alter and resist force as your body weight wants to sink between your shoulder blades, right? So stopping yourself from sinking down. And I see trainers fall into this trap of like getting too bottlenecked in their definition of core. It's being like, oh, core is, you know, the big four: rectus, transverse, internal, external. But it's like, you can train those fine on this Roman chair, knee ups or straight leg raises or whatever. But if the core to me is more, you know, the core is more than that. So if I see someone just tucking their tailbone underneath and doing straight leg raises, but their shoulders are up in their ears, it's like, what an opportunity missed to utilize those lower traps, to stop that elevation and upward rotation, right? Because if lower traps are, you know, trained in some Y raise, overhead, face down, Superman bullshit, it's like, if you can get into this position, then likely the compromise is somewhere else, right? If I can get in a position to do a Y raise to help better improve my overhead position, it's like, well, I'm already here, so it mustn't be the lower trap, right? So if I get someone that's, ow, it's painful here, it's like, hey, let's actually take this to the Roman chair and train the lower trap to create a net downward force or resistance of force as it upwardly rotates. So and dips would be the same thing. Right? Dips would be an example of like a really good lower trap exercise that have us reaching low, right? So a lot of times we get so fixated on the problem that we really miss a perspective on the solution. It's like, oh, problem in the overhead. So they take us right here and go, okay, we're just going to stay here, which is like, okay, there might be some benefit to like attenuating or inoculating this position, but the real fix is going to come down here, right? Like in this lower reach position. And whether that's lower reach or lower carries, being able to like almost look at your program from an inventory standpoint and be like, are we just hammering the overhead position? Maybe we just need some variability in load from a push-pull perspective in this low position. Then on top of that, if you're aware of that contrast of reaching high versus reaching low, or pushing high, pulling high, reaching low, pulling low, the variability just comes out in the wash. You don't really need to be that specific with it. You can just reduce the amount of stress on some of those tissues, load them in a different plane, and then lo and behold, as you improve your ability to maintain or progress through time, distance, and load, you start to have the function now to carry yourself into that overhead position. Because that's something that I see coaches all the time. It's like, my client has an issue with the overhead position. We do wall angels before the workout, and then we do Supermans on the ground. It's like, man, that's already sounds like a lot of overhead work for someone that can't get in the overhead, right? And then they go overhead press them. It's like, what are we doing, right? So a lot of times the answer is the inverse, right? And we see this so often in biomechanics. It's like the answer is in the complete opposite place. Oh, your knee hurts on the front. Well, maybe it's something in the back of your knee. Oh, it's something hurts on this side of the body. Well, maybe the cause is the opposite ankle. So like that asymmetry is something that I think you should always be mindful of. And I think when we look at the shoulder, trying to making considerations in lower positions of shoulder flexion rather than just trying to hammer that red line position of human function. It's like, take some time, reach low, and I guarantee you reach high. That's kind of always something that I see as a common mistake that coaches make when it comes to attempting to rehab shoulder injuries.
Yeah, I like that you talked about carries there also, because what Roman chair is for you, that's farmer's carries for me, right? What better way to get someone to organize their trunk, their core musculature to create stability from the pelvis to the rib cage, stay nice and stacked, and then start to build capacity to maintain scapular depression. So that's a lot of times where my overhead progressions will start, is that, okay, we can get you to start to build competency around maintaining a neutral torso position and awareness around scapular depression. Because what do you see most times with people that are shit at getting overhead is they have these elevated scapulas up to their ears. Usually there's a high degree of internal rotation. And then my progression from that is just simply a farmer's carry with external rotation at the shoulder. They're starting to get into kind of a palms forward position, because now we're starting to build a little bit more competency around scapular depression and glenohumeral external rotation, so that these aren't foreign concepts to them, and it's just being reinforced by gravity. So that's probably one of my favorite ways to get people to start to build awareness around how they need to be able to use their body to lower that barrier of entry into the overhead position.
Right. I like that idea of like using the eccentric load as like an entry point. So like following what Jay's saying, it's, you know, the Roman chair is a concentric orientation of the trap, in the sense that the load is a net upward force on the scapula that forces them to contract against it in order to have their ears not fall up, or their shoulders not fall up to their ears. What Jay's saying is like, we're trying to get people into the Olympic lift position. We need to get it out of their traps first. So a Roman chair for an Olympic lifter who's like very novice might be even too much. So we actually want to depress those scaps by applying a load downward, which actually creates that downward rotation that we're looking for, suggesting that external rotation. So they can almost like do this as a form of passive mobility first, so that when they do get into something that is, you know, creating a net downward force on the scapula, like a snatch in the overhead position would absolutely create a net downward force on the scapula. They have a range in which to accept that first, right? A lot of people, and you see it, and you know, you have way more experience than probably anyone with dealing and teaching the Olympic lifts, but it's like you see people trying to get under a snatch for the first time, and their inability to accept that load through the shoulder blades, and their wantingness to stay in this upward rotation, very upper trap dominant position, is what kills their bottom position in the hole. And it's like, well, if you can just load them out of that and teach them to, like, as you said, organize their scapula with their rib cage, with their pelvis, that's really the name of the game, as far as like, from me, from a mechanical perspective, in the bottom of a snatch. When it goes wrong, it's people not being able to organize that, and it's usually from the outside in, right? It's usually from a scapula that's, you know, doesn't have an ability to stabilize dynamically. And I think that's something that people miss, is that stability is not just a static objective outcome. Stability is not resisting force by not moving, it's resisting force while it's moving, right? Like dynamic stability. And that's something that the serratus, the low trap, the rhomboid, the levator, mid and upper trap are all going to have this sort of this orchestration of dynamic stability. Even though there might be one that's loading concentrically, one that's loading eccentrically, they need to be able to have this very fluid push and pull for positions both proximal and distal to be achieved. So it's something that, you know, if we were to organize these as far as like the most novice to more advanced, is like, okay, we have someone who has shoulder pain in the overhead position, very, you know, beginner lifter, young training age, maybe farmers carries with that external rotation might be a place to start. Get them, force them into learning that depressed scapular position, that opened and externally rotated position. And then from there, then you might want to consider introducing like graded net downward forces, like a Roman chair or something like that, and obviously progressing the skill of whatever overhead position you're attempting to load. And for me, like one of the best tools in training and rehabilitation around the shoulder, and it's been around literally since day one, the adjustable bench. The adjustable bench to me is probably one of the most versatile tools in the gym. And to take someone, like, we can just grade it 15% a week if the bench is, you know, well equipped to do so. So it's understanding that, hey, look, the medium is going to dictate the message, right? So the machine is something that is high output, low skill, little need for, muscular co-contraction, little need for, and not even little need, but might even dissociate or remove the need for that co-contraction that we call scapular humeral rhythm. So let's reintroduce, like, one of my favorite progressions for rehabbing a shoulder. And sometimes these progressions happen in a single session. Sometimes these progressions take a month. Sometimes these progressions take 6 months. Right. But it's like floor dumbbell press, neutral floor dumbbell press as a movement that, like, let's say we do some warm-up drills at the shoulder. One of them in early stages might just be this basic farmer carry, right? This loaded distraction. We have like an irradiation principle that keeps the shoulder stable because we have to grip these heavy objects rather than just dangling them off our wrists and separating our AC joint transiently. So loaded heavy farmer's carry, supinated wrist position, externally rotated shoulder. And you go right into that with dumbbell floor press. A lot of reference points, a lot of external stability, but we augment that stability slightly with using an unstable medium like a dumbbell, right? Then take that from the floor to the bench, right? You can go floor to the bench and then bench to 15 to 30 to 45 to 60 to 75 to 90 degrees. And, that progression could be set over set, getting to a particular endpoint where we feel stable in the balance between skill and output, or that could be weeks on end. Right, I've had people with chronic issues where it's, hey, we need to regress back to their warm-up being something at the T-spine, something at the scapula, something to inhibit internal rotation, and something to suggest external rotation. Then an integrated movement like a farmer's carry, then a floor press, right? Yeah. Then that floor press is something we do for 2, 4, 6, and we progress in time, distance, load. Well, not distance per se, but time and load. 10, 12, 15, 20 reps. Then once we build a base, we allow that shoulder to go into more extension. We put them on a flat bench, and then we just use the incline chair as sort of our constraint that allows us to work within a particular range. And then we just start to load in some of our accessory movements based off of what we talked about earlier. Yeah. Right? Like, one of the things that a lot of gym goers, I think, aspire to is a pull-up. Right, I think that's something that's a pretty good, like a ubiquitous, I don't want to say novice even, but a ubiquitous training goal is a pull-up. And like, depending, because you were probably one of those kids that could just always, you were probably like a monkey spidery kid that was always pulling himself up on tree houses or some shit.
Right, yeah. I've been doing
pull-ups forever. So you ever remember a time where you couldn't do a pull-up?
No, I do remember in like straight up grade school, like 3rd grade or something. Did you guys have like the fire pole in the play yard?
Yeah.
I had a hard time getting up the fire pole, climbing up it, but I could do it.
In the 3rd grade?
Like, yeah, 3rd grade probably.
Dude, remember in Superbad where like they talk about the one kid who's had abs since like the 3rd grade or like kindergarten? I feel like that's Jiunta. You know who that's not? Me. I remember being, fuck, dude, 18, working to get my first pull-up.
Yeah?
An 18, maybe not 18, but like 16, 17.
Yeah. I feel like that's fair,
and if I were to go back.
What'd you weigh at 16, 17, though?
A 180?
Yeah, I'm still trying to get to 180.
Okay, fair point. Genetics plays a role. But like, if I were to, and I have written progressions, because to me there's nothing like, the snatch is obviously very technical and its potential for load is like decently high given the shoulder position that you're in. Mm-hmm. But to me, there's no greater marker of upper body strength than weighted pull-ups. Like, if I just see a guy just strap 4 plates around his wrench and just start pulling himself up, I'm just like, what the fuck did I just see? Like, because the dip is a compressive force primarily, right? The bench press is a compressive force primarily. But, I'm already, 260, and I strap another 90. It's like, there's so much testing of, the limits of your function at an unstable joint already. Right. Like, just 260, if I just let hang, it's like, that's a lot of distraction force. Yeah. Add on to that additional body weight or like extra physiological or supra physiological body weight by way of weighted belt, and then be able to organize this distraction force. That to me is like the ultimate sign. So for me, using pull-ups as like a proxy of shoulder function is something that I've always seen best worked when simultaneously or concurrently programmed with dips, much for the reason that we talked about earlier, right? Like if I'm in a dip immediately, that scapula is going to have to be dynamically stabilized. We're going to have to make sure that that we can stop that scapula from elevating up too high or upwardly rotating too much. Then as I lower down into this extended position of the dip, the lat actually is able to create glenohumeral depression, right? A lot of people get really scared in the bottom position of a dip and think that, oh, it's like a little bit dangerous. And it could be. It's a ton of stress on the anterior, like the anterior long head of bicep rather, anterior labrum. But it's also testing the lat and biceps ability to create glenohumeral depression. Like your shoulder joint wants to just come right out. The anterior shoulder is not well encapsulated with bone. There's really just the capsule there that keeps it in place, the long head of bicep tendon, but the lat really helps pull that humerus back into a stable position to begin to create elbow extension and shoulder extension. So the dip to me, when it comes to like rehab exercises at the shoulder, a lot of times like people can't do pull-ups. Like my elbows hurt when I do pull-ups. It's like, why don't you try doing like some assisted dips, right? So that lat can actually work at or function properly as a glenohumeral depressor before you go acting, in the overhead position, to have that lat just be a long lever extender of the shoulder.
Yeah. And kind of to layer onto that progression you were talking about in terms of shoulder rehab, like working from a floor press all the way up to like a 90-degree overhead press, I use kind of the same principle in terms of, push pull. What is the linchpin of this movement, I guess you could say, is a lot of that's kind of based around like glenohumeral joint, because you have the stability of a bench to stabilize the spine, the scapula. Right. So I like to add in things like a landmine press, like a half kneeling landmine press, and like a horizontal row, and then kind of grade that in a similar way you would that dumbbell press, because now the two things that are going to be the linchpin in that movement are going to be core control and scapular control. So just like you have them working on glenohumeral joints, say with the dumbbell press, is if I have someone start out with just a horizontal row, you're at least working through some degree of protraction, retraction, right? And then if you get them on a cable and you take that, say at the same rate, like 15 degrees a week, up, overhead, 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 in terms of like a half kneeling row, you're getting them to slowly work through not just protraction, retraction, but you're slowly starting to get them into that upwardly rotated scapular position and start to build some sort of competency of, the combination of protraction, retraction, elevation and depression that scapular upward rotation is. So you're getting them gradually to get to be in that position, create trunk stability, and then control the scapula as they go through that rowing movement. And then a similar thing with like a landmine press is you're giving them that external stability, that broadened base of support with the landmine. And yes, you're asking them to control the glenohumeral joint, but that's almost purely at that point going to be dependent on lumbar position and scapular rotation. So kind of layering things like that in with that progression that you mentioned can help you target whatever that person's weak link might be, right? Is it a glenohumeral issue? Is it a scapulothoracic issue? Is it just a core control issue? So that's the way that I like to look at those things.
I want to layer it one more, because I feel like this is what people are going to, like, that are listening to this podcast will be listening for, is like the actionable day-to-day prehab, rehab, corrective exercise. I think, look, don't upload the DMs because you don't like the verbiage. Go fist yourself. Like, I don't fucking care. People know what I mean when I say that. Like, what are the drills that you prescribe most often leading into a workout? Because I feel like we kind of reverse engineered this of like, hey, real biomechanical decisions are load management. All right. That's really where this whole thing is going to live and die. But there are things that we can do in the transient, in the short term, to integrate into our loading that undoubtedly, even if, look, anecdotally, if you do this long enough, you just realize that, hey, this works. Mm-hmm. What exercises do you put in that like warm up slot for shoulder pain more often than not?
For just general clients, are you asking? Like kind of go-tos?
Yeah. I mean, general clients with shoulder issues.
Right. A lot of times it comes back to like lower level stuff for me. There's a progression I'll go through, but for me, it always comes back to building competency around scapular control. So that could be things as simple as a scapula push-up or a scapular pull-up, and understanding what you're doing. And then the progression for that is always going to be some sort of more open chain exercise, right? Where they're controlling the core and maintaining scapular control. So like it could be you're doing a superset of scapula push-ups, scapula pull-ups, and then our next thing from there would be like a half kneeling dumbbell press or a kettlebell bottom under press or something like that. And then something to kind of, I guess, eccentrically load into those positions that I really like that we haven't mentioned yet. It would be like a dumbbell pullover, where you're kind of on that fixed surface of the dumbbell and you're eccentrically loading into that scapular upward rotated position with a degree of external rotation through the glenohumeral joint. So there are a couple that I'll rotate through depending on the skill level of the person. Yeah,
because I feel like that's where the learning really kicks in, is that awareness. And the one thing, and it's almost like a grievance I have to file with people who don't like prehab stuff, because the shoulder only works it works in a large plane, like many planes of movement, but there's only certain ways it can work well, right? So like there's only, if you watch the Olympic weightlifters, the shoulder joint's really gonna leave a particular movement signature to successful Olympic weightlifters that basically would indicate that for this particular task, if it doesn't move like this, we're gonna have some problems, right? Yeah. The bench press, the shoulder can move any number of ways, but really when we perform a bench press, shoulder can, as a small margin for error under load, which a lot of people treat shoulders because they have such a high amount or high potential for movement variability. They look at the rehabilitation process like kind of a grab bag of variability of positions. It's like, no, we need to relearn the proper way. And I feel like it almost makes shoulders on the outward facing like a little bit more difficult, because it's like people look at the shoulder and go, well, it's so variable in its movement. Really anything will change the perception at the shoulder. But it's like, yeah, that's all well and good, but you're going to want to make sure that when you actually load the damn thing, you're loading it through the planes and degrees and biases towards rotation and all that, and necessary positions accommodating at the scapula and thoracic spine that proper shoulder mechanics allow for. And proper shoulder mechanics are just, look, these are the mechanics of the shoulder when they move under heavy loads that seem to allow for the greatest amount of performance. And the greatest amount of performance, whether it be heaviest weight or fastest pitch or whatever, they leave clues, right? And by leaving those clues, you can begin to try and create a map that navigates away from anything that's not those positions or coupled mechanics at the shoulder. So I think that's one thing that a lot of people glass over and then kind of look the other way on the prehab stuff. Like, hey, if getting your T-spine into more extension before you train alters the way or the positions that you train or the perception of the positions that you train in, it's like, that's not a bad exercise, right? Because I think there's been a weird like pendulum shift towards, crazy amounts of like rehab foam rolling, lacrosse ball, Theragun, to like, no, it's all just load management. It's like, look, there's a lot of people that got really better, really a lot of better with these implements, right? Like, we can't just do away with that. Right. And they are just that. They are learning tools. I would put them on the same pedestal as like training wheels, in the sense of these are going to guide your attention. Like, if I start pulling a little left on my Schwinn 10 speed and my training wheel hits the ground, I was like, oh, that was feedback, right? It's the same thing. Like, a foam roller can be just an awareness of the thoracic spine. People don't know where the thoracic spine is. There are people that think the spine is in the center of their body. It's like, what kind of mongoloid weird robot person are you that you think the spine is in the center of your body? So, and that's where, the online coaching shit talking comment section people who like to tear down foam rolling and lacrosse balls, it's like, these are all tools. They're all just references that shine light on different positions of the body that most people don't have a kinematic awareness of to begin with. Are they breaking down scar tissue? Fuck no. Are they creating awareness at the posterior shoulder? Are they creating awareness at the T-spine? Yeah, then that's never a bad thing. Just like the protraction plank or the windmill creates awareness at the serratus, which we can then use to integrate into an actual exercise. There's nothing wrong with using a different nervous system pathway to create awareness at different segments of the shoulder, whether it be, hey, I'm putting a lacrosse ball in my infraspinatus. Great. What else have you done for your infraspinatus lately, right? That's definitely going to be something that will more often than not yield a benefit in the learning process. And I think a lot of people can do away with their biases and judgment around the word corrective exercise. If we look at all exercise as learning, I think that opens up the opportunity to begin to justifiably use some of these training tools as teaching tools.
Yeah. That's a really good point. And I think the big thing to take away from that is that it's not good or bad, right? It's a scale of effectiveness for this person at this time, right? And everything exists on that scale to more effective or most effective to least effective. And it's trying to match those two variables as closely as you can to be most effective most of the time with that specific person at that specific time. So,
because our biggest enemy, what we're up against as coaches or practitioners, is time.
Yeah.
That's
right.
really what, like, if you go see someone, it's like, for the most part, there's a natural history to pain. And you can look this up. Like, you can look up, like, what is the natural history for, like, idiopathic neck pain? I don't know. Like, if you don't do anything and it's not a tumor, it's going to be like, I don't know, 14 days maybe. It's like, look, you're going to go through it. If you don't do anything, just throw some dirt on it, go to work and shut the fuck up. You'll have neck pain for 14 days.
Right.
But it's like, if you go see a chiro or you have like shoulder pain, you go see your trainer, it's like that shoulder pain probably has a shelf life, right? If you just go about your day, you might introduce enough variability or reduce enough load that your pain, the perception of that pain goes away.
Yeah.
A good coach is going to try and beat natural history, right? Like, you can take someone walks in one day like, oh, I slept wrong, my shoulder hurts. I'm like, all right, let's kind of like take a look under the hood and move around. Let's create awareness at the T-spine. Let's create awareness at the scap. Let's create awareness of our biases towards internal and away from external rotation. And let's try and relearn a bias of pain-free movement. Right. And that's really what that becomes. And a good, diligent coach can take someone through that learning process and use those learning tools in an expedient fashion, right? Where it's like, well, we'll do this week and we'll do that this week. It's like, you know what? Time probably did a lot of that work for you, right? In the time between the two sessions, the natural history of that pain is going to play its course and work out to your benefit as a coach. You're like, oh, look how smart I am. It's like, yes, the guy hasn't lifted in 6 months and he's no longer in pain that he used to have from lifting. It's like, what did you think was going to happen? But that's so often the protocol is like, just foster them while time does their. The nice thing about time is it's free, right? It's free in the sense that they're not paying time an hourly wage to sit there and watch them just do scapular push-ups forever, right? Like, your goal is to be able to integrate it in a way where they relearn that pain-free movement bias as quickly as possible.
Yeah. I think on so many levels, this whole conversation comes down to two words, and that's awareness and learning, right?
Yeah.
Like, on like the coaching level, on like the patient or the person that's experiencing pain, like, a lot of this comes from just building awareness around why it's happening and how you could prevent it from happening or resolve the issue. And then that requires learning how your body works, learning about how to create better positions or better strategies so that you can buffer force into shoulder or insert whatever joint here, so that you're not just stressing this specific place time over time. Again, a way that it's not gonna, there's two things that can happen. It can either adapt or it can break down. Right? If we stress it the right way, it's going to adapt and we're going to get stronger and we're going to be able to buffer more stress through that area. If we stress it the wrong way, it's eventually going to break down and it's not going to allow us to load anything through that over time. So
I think archiving exercise programming is such a lost art. And like,
right.
I went to a restaurant once in northern Spain And the food was the best food I've ever had in my entire life. It was like a little hole in the wall spot that there was no tables, standing room only, and it was open for like 4 or 5 hours a day. And then they had a nap in between. Like literally it was like open from like 4 to 7 and then closed again until 10. And then it was open from like 10 to 1.
Nice.
Like that was the whole go. And it was all small plates, and the servers, who knows, maybe they were making it up, but it seemed as if they remembered my order and 100 other people's orders plus drinks. And at the end of it, they were like, okay, you had the 3 things of octopus, the 4 risotto, the Diet Coke, and the filet. I was like, it was like an auction house in there. Like, how the fuck did you remember that and everyone else's orders? Like, and then did the math in her head, and it's like, yeah, that'll be whatever, $63. And I was like, that was incredible. And the next person's like getting their bill and they're doing the same thing. And meanwhile, they're taking orders for new faces. But that's like a really good coach to me, right? Like a really good coach, that awareness over time allows you to establish trends, right?
Yeah,
and like
exactly.
a good coach, like computers can teach us what brains should do, and brains can teach us what computers should be able to do. Like, and right now, the big thing with computers, and not right now, it's been happening forever, but like big data allows you to see these predictive things that can correlate. Like if we had enough data, people with shoulder pain that weeks prior had like a twinge in their elbow and use that specific word, you kind of start to pick up over time if you're a coach that can archive. And if you can't, look, grab a pen and a pad, or grab a computer or a spreadsheet and document all of it and sort of review the black box that is their training, right? And understand like the black box has a side component or a side hard drive for the stress of life outside the gym. But try and start to recognize over your career as a coach, like what are the associated like prodrome symptoms that we start to see? Like, what's the cloud cover that comes in before the storm? What does that look like, right? You know, is it happening after heavy pressing days? Is it happening after heavy squatting days? And with enough data, everything comes out in the wash, right? There are undoubtedly trends that me and you are missing, but that collectively, if we could start to archive and index everyone's exercise across the world, both objectively and subjectively, you'd be like, oh, shoulder pain seems highest linked with these populations, with this at this time of day. You know, it's like if you ever talk to a nurse on a full moon, like an ER nurse on a full moon, there's enough data of full moons and crazy shit happening where it's like nurses don't need to think that, you know, Mercury's in retrograde and that's why people are popping off. But it's like, look, I don't know, but I know I usually call in sick on full moons because I just can't deal with that bullshit, right? So that's where I think a good coach can become a great coach over time, is the awareness, the learning that comes with the awareness, and the ability to create trends and recognize trends. Because with shoulder pain, it's something that, you know, could have peripheral indicators that you're just not aware of because you don't see them as potentially correlated and or causal.
Yeah, absolutely. And that comes from collecting data points too, is you have to ask the right questions. You have to pay attention to these things. And then, you know, maybe every Wednesday on their program, they have elbow pain while squatting, but they bench heavy on Tuesdays. And then when you move their squat and their bench press further apart, it goes away. But if you're not paying attention to that correlation, maybe causation relationship there, then you're missing an integral piece that could help you circumvent this problem from happening in the future. So it's paying attention and, like you said, retroactively reassessing, looking at a problem that popped up and figuring out why that happened, or at least a correlation of what might have caused that to happen, or a hypothesis, things like that, where you're actually starting to analyze the things that are happening and ask questions about it. And that's how you start to refine this over time.
Well, it starts from a structured, like you need to have clear meso, macro, and micro cycle structures, so that, because each one of those is in itself going to be a variable of the potential injury equation, right? Like because you need to basically do a level of analysis, or you need to analyze at every level. The meso, is the load too much? Has it been too frequent, right? What have we been doing the last 3 or 4 training blocks? Like, what are the big rocks? It's like, my elbow hurts or my shoulder hurts. It's like, well, you sure have been doing a lot of shouldery things, right? Like, that's a pretty good place to start. And then, so like down to the micro level, it's like, what does our warm up look like on a day to day? Is it consistent, right? So if we can structure programming through like meso through cycles, macro that, makes up, or sorry, macro, meso, micro. So if we can start to look at, mesocycles, like what is the overall goal of this training cycle? It's like, well, it's to improve overhead strength. It's like, okay, we're probably going to be in the overhead a lot. So being able to augment or change or differentiate the dose of overhead movements so we can recover from the stress and hopefully derive an adaptation, that's a consideration we can make. And I would usually start most of my decision making by looking at things through a much broader lens. But that's not to say that's where my decision making ends. It's like, all right, let's first consider shoulder pain from the big rocks of load management across a macro cycle. Then let's break that down, into what we've been doing in a mesocycle, and let's then break that down further into microcycle. What is our day over day? And if those are structured within, it's just a very finely tuned equation of like, well, we have a bunch of variables that are actually now constants based off of this structure. Let's tweak one of the variables and solve, right? Because it's like, you might not think foam rolling, quote unquote, works, but if I put in foam rolling, it's the only thing I change and they're out of pain, guess who doesn't give a shit about your opinion on foam rolling, right? The client that's out of pain, and on to the next. And then you save that data point as something that you can reach to in similar scenarios under similar loading paradigms, at similar demographics, at similar strength and skill levels. Now, for some people early in their career, they might not have a lot of data points. And don't think that because foam rolling worked for 65-year-old Tim that it's going to work for 16-year-old Jenny, right? Those two cohorts are, but if you have enough people that you train over your career, it's like 65-year-old Tim and 63-year-old George. Hey, foam rolling seemed to really work with Tim. Hey, George. Oh yeah, Tim's my neighbor. We went to high school together. Get on the fucking foam roller, George. Like, you know what I mean? And over time, that data becomes a much more valuable because it's backed by much more experience, right?
Yeah.
So I think that because there's a lot of dimension to dealing with pain. So just to kind of briefly recap, asking the right questions at the right levels at the right time. Mm-hmm. Someone is coming to you in pain, take a look at it from a macro perspective. Like, well, what has their load been? And sometimes maybe it's gone from 0 to 60, right? Maybe there's been nothing and now all of a sudden it's a lot. Right? Or maybe it's just been this prolonged, unrelenting, just onslaught of the overhead position. So ask questions, big biomechanical, high yield questions. Like, are you just loading your fucking shoulder too much? Right? And the answer is, don't load your fucking shoulder that much. Then into the habits that we see in a meso based off desired adaptation and a micro from day-to-day habits. Then you can start to, and I would recommend doing all three. Right? Because I feel like the macro stuff is really valuable from a coaching perspective in likelihood of potentially causing an injury or that injury leading to pain. But from a psychological perspective in your client's end, it's the changes you make on a day-to-day basis that signal to them that you recognize that they're in some sort of pain and something is to be done about it. Whether a purposeful omission of an exercise, a purposeful inclusion of another exercise, something at the mechanistic level that can explain that, look, today was a day where we got better. Today was a day that we moved towards the goal of pain-free loading in the overhead position. So a lot of people understand in our position as coaches that, hey, the big rocks are the big picture. The big picture is that macro meso level, load management consideration. But clients don't understand that. No, they don't have to, because that's why they're paying you fucking money to train them. So they need to know at the psychological level. And if you understand that pain is a perception, an emotion, and a drive state, that you're not going to get your client out of pain without making these day-to-day concessions on a micro level and these actionable, specific, this is to manage the perception of your pain. That's half the fucking battle, right? And that's, again, where like the comment section warriors and the research crowd who's never spent a day in the gym, that's where they just miss the plot. They go, it's all load management, nothing matters, foam rolls are bullshit. It's like, all right, man, but you know what's not bullshit? What this guy keeps between the ears. And if he has an aversion or a fear of an exercise, and you can like, what's the what's the movie where, is it Big Daddy, where he's like, oh, when he has the sunglasses. Remember in Big Daddy where the kid wears the sunglasses and he thinks he's invisible?
Yep.
That's almost like what the corrective exercises are to the psychology of a injured client. It's like these corrective exercises give them sunglasses so they can act invisible to this pain that they perceive. Like, you know, oh, look out. And we know it's so silly in the kid, but it's the same learning, right? Like if there hesitation, like hesitation has injured more people than Joe Siedelman ever has. Yeah. Right? Like the hesitation that comes with an aversion to pain and that perception of pain. If you can go, here are your magic sunglasses by way of static stretching, foam rolling, inclusion of new exercise, exclusion of old painful exercise on a micro level, they're gonna relearn a bias towards pain-free loading so much quicker than go, yeah, you know, next mesocycle after 6 weeks off of nothing in the overhead, we should be pretty good to start to scale back to the overhead. It's like, what are you doing? Right? Give them this safety blanket, because that's what protects the psychology, and that's going to be an undoubtedly one of the stronger links associated to pain, especially in a novice client. You can logic an advanced training age client and be like, look, dude, we flew it real close to the sun. And be like, yeah, I'm going to take some time off the overhead for a bit. But the people that are going to pay you money, it's like, no, be there and give them these safeguards, these anchors, these touch points, these safety words. You'd be like, banana. It's like, okay, well, hey, we're not going to do it. Give them control. I think that's what it does. I think it gives them the perception of control, which gives them a sense of freedom that they can liberate themselves from perceiving that pain.
Yeah. And people that are more general and like lower training age. I just saw that. Yeah, that's a lot, man. But I was just going to add to that people that are lower training age and have more generalized goals, the idea isn't just, I forgot totally what I was going to say there. But
well, people with generalized goals, lower training age, that might be that might succumb to the psychology factor of
right.
Go.
Yeah, no, that's exactly what I was going to say, is that it's going to be a bigger psychology game for them than the actual physical adaptations, right? So it's, you know, someone that's higher training age has, you know, larger aspirations that, you know, maybe they're going to set a world record. They know no one cares how you feel. Do the fucking work. Do what you have to do to either get out of pain, do what you have to do to, you know, hit the working set. But people that have more generalized goals, then it's going to be more, I don't feel this. I don't feel right today. You know, it's going to be more about the psychology or their mindset coming to the gym, how well they're going to perform, or, you know, there might be other factors in terms of like life stress, work stress, that's going to play a factor into how well they're able to execute in the gym. So that's important.
And if you lay down this psychological trail of breadcrumbs, one of my favorite coaching moments in a Gen Pop setting is when you turn them into dogs, where you got a guy who's like, you know, maybe a little bit soft, doesn't want to push, like, oh, I felt this thing when I was at the printer today, and I don't know. When you can get that guy and through like, oh, okay, like, yeah, early, just be like, yeah, sure. Kind of Hansel and Gretel them in, invite them in, fatten them up. And then next thing, you know, like, you know what, I fucking, and sometimes it's like too far. Or it's like, yeah, I think I broke my elbow. PR or ER, like, where, dude, do you remember the first session where you couldn't even deal with a copy room and now you're trying to, but that's the only way you're going to get someone there. Is by meeting them where they're at, right? This training shit number, like 101 is meet them where they're at. Yeah. But it's like be able to take them real close to the sun. Like there's nothing like getting someone who in their workaday life, you know, they put on a suit and tie, it's yes or no, sir. And then like you look at them before like a potential PR and they go, load it. You're like, oh yes, that's the dog right there. And that is as much a progression as every sort of periodization wave loading thing, and we're so blind to it as coaches because we get so lost in the nuance and the minutia that you forget that one of the biggest changes that training has on general population people is the confidence to lay out for it, right? Like, yeah, no, I got it, let's go. Like, and sometimes you got to rein that in, but like getting someone to be confident enough to be like, I fucking got this. It's like these people, I've had people who couldn't even like bend over to tie their shoe. that next thing you know, they're bending over to pick up a 300-pound bar and they told you to put it on the bar. It's like, yes, that's the progress. That's what we do this for. Like, the rest of it's just numbers. Like, I've seen guys deadlift over 1,000 pounds, but man, have I been hyped for that guy who couldn't tie his shoe to lift 300 pounds. More hyped than any world record I've ever seen. And guess what? So were they. To them, that was 1,000 pounds. Like, fuck you. Not you. I get excited, man.
I know.
But yeah, so I mean, shoulder pain in general, I think highlights a lot of principles of pain. But I think looking from the outside in perspective level, but making actions and decisions at every level. Don't be a fucking nerd. You know, be a compassionate coach that understands the necessity from psychological to physical, and be able to leave this trail of breadcrumbs for both, where, you know, hopefully that you don't have to make these concessions. That pain is something that we keep at arm's length by proper programming and load management, execution, preparation, the whole 9 yards. Jay,
what's
we
up?
did it.
We did it, man.
Another one. Another one. Can you put in, like, who says that?
DJ Khaled?
DJ Khaled. He's like in the fitness. He's about it, though. Yo, Lundy, you could tee him up. Lundo versus DJ Khaled.
Damn.
Squid. Okay. But yeah, I think even though that wasn't a bullet point list of do this, do this, do this, do this, I think if you read between the lines on that, you'll get very far in managing shoulder pain. And I think we had some takeaways there on the exercise selection standpoint that'd be super helpful. But
yeah,
that this is more of like a meta theory behind shoulder pain in general. Guys, I hope you enjoyed the episode. If you did enjoy the episode, I don't know, do we even still have ratings on iTunes? It's been so long since we did that. Go do a thing on iTunes or Spotify, or do a thing that tells us that we're great, and send this to your friend in shoulder pain. But that's it for today, guys. Appreciate you hanging out. Jay, Lundo, we'll see you guys next time.